Today we'll understand how ionizing radiation affects the human body, from the cellular level to clinical syndromes and long-term risks. As radiographers, this topic is critical because every exposure we deliver has biological consequences. Knowing the science helps us practice safely and responsibly. Radiation damage begins at the cellular level. Somatic cells form body tissues and contain 46 chromosomes, so damage affects only the individual. Germ cells carry 23 chromosomes, and damage here can affect future generations. Clinically, our priority is minimizing dose to both, especially reproductive organs. Radiation damages cells by two mechanisms. Direct action occurs when radiation hits DNA directly. Indirect action, which is more common, occurs through radiolysis of water, producing free radicals like O and hydrogen peroxide. Since human tissue is over 75% water, indirect damage dominates in clinical practice. When DNA damage is misrepaired, chromosomal aberrations occur. Examples include dicentric chromosomes, ring chromosomes, and acentric fragments. These aberrations are dose-dependent and are used in biological dosimetry, especially in radiation accidents. This curve explains why low doses may be repaired while higher doses cause cell death. The shoulder region represents sublethal damage repair. Once repair capacity is exceeded, cell survival falls rapidly. Cell death here means loss of reproductive ability, not immediate destruction. Radiation effects are classified by target, timing, and dose response. Deterministic effects have a threshold and severity increases with dose. Stochastic effects have no threshold and probability increases with dose. This distinction forms the basis of radiation protection principles. At doses between 1 to 5 gray, bone marrow is severely affected. Patients develop lymphocyte depletion, infections, anemia, and hemorrhage. The LD50/60th value, about 3 to 5 gray, means 50% mortality within 60 days without treatment. At higher doses, gastrointestinal syndrome occurs due to destruction of intestinal lining, causing severe diarrhea and electrolyte imbalance. At extremely high doses above 25 gray, central nervous system syndrome develops, leading to coma and death within hours to days. Survival at this level is not possible. This slide shows localized, deterministic radiation effects, where damage depends on dose and the specific organ exposed. Low doses to the testes, 0.15 grays, and ovaries, 1.5 to 2 grays, can cause temporary sterility, while higher doses lead to permanent sterility. At 3 grays, hair follicles are affected, causing temporary hair loss. The eye lens is highly radiosensitive. Around 5 grays can result in cataract formation years later. For the skin, 6 grays causes erythema and epilation, and very high doses of 10 to 20 grays lead to severe burns, tissue necrosis, and permanent hair loss. All these effects have a threshold, which is why precise dose control and shielding are essential in radiography. Cataracts are deterministic with a clear threshold dose. Cancer is stochastic, meaning there is no safe dose. Severity of cancer does not depend on dose, only the probability does. This is why even low doses must be justified. Data from Japanese atomic bomb survivors clearly shows increased solid cancer risk with dose. At doses above 2 sieverts, observed deaths significantly exceed expected values. For radiation safety, the linear no-threshold model is assumed. Leukemia has the shortest latency and highest relative risk. Significant increases are seen above 0.2 sieverts, especially at marrow doses above 2 sieverts. Below this, risk is assumed proportional for safety, even if statistically unclear. ICRP estimates cancer risk at 5% per sievert. That equals about 50 excess cancer cases per million people per millisievert. Compared to natural cancer risk, radiation risk is small but not negligible. Hereditary effects result from damage to germ cells. No direct human evidence exists, but animal data suggests a risk of about 1% per sievert. This reinforces strict dose control in reproductive age patients. Radiation causes ionization, free radical formation, and DNA damage. Deterministic effects require thresholds, stochastic effects do not. Our guiding principle is ALARA, as low as reasonably achievable. As radiographers, patient safety begins with us.